So, hi everyone. Today we are dealing with the basics of ECG. Basics of ECG. So, starting with the leads of ECG, there are 12 leads in ECG, and it is broadly divided into unipolar and bipolar. Okay, here we have bipolar leads. Here we have unipolar leads. The bipolar leads are 3 in number. Okay, they named as L1, L2, L3. Lead 1, lead 2, lead 3. Again, unipolar leads are rest of 9, and they further divided into augmented unipolar leads and chest leads. Chest leads are lead V1 to V6. The augmented unipolar leads are AVR, AVL, AVF. So these are the basic classification of 12 leads in ECG. So now about the bipolar leads in detail. Bipolar leads. Basically, this is a triangle representing the limbs. So this corresponds to right arm, left arm, and left foot. The potential difference between right arm and left arm is measured by lead 1, and between right arm and left foot is measured by lead 2. Between left arm and left foot is measured by lead 3. Again, this right arm is negative and left arm is positive for lead 1. So the current flow is from negative to positive. So it will be like this. Again, in lead 2, right arm is negative and left foot is positive. The current flow is from right arm to left foot. In lead 3, left foot is again positive and left arm is negative. So the current flow is like this. So from this diagram, it is very clear that lead 2 is equal to lead 1 plus lead 3. Okay, that is lead 1 means left arm minus right arm plus lead 3 means left foot minus left arm. So this got cancelled, and the remaining thing is left foot minus right arm. That is our lead 2. Okay, so this equation is called Einthoven's law. Okay, Einthoven's law. Now a few words about the augmented leads. In augmented leads, the letter on the right side indicate the positive end. For example, in AVF, okay, left foot is positive. In AVR, right arm is positive, and in AVL, left arm is positive. Okay, so only one limb is active. Okay, in bipolar leads both the limbs are active. In augmented leads only one limb is active, and the inactive limb is called reference end. Okay, reference end. Okay, then about chest leads. Chest leads, it is very important to know the positions of chest leads. Okay, V1 is placed in fourth intercostal space right of sternum. Okay, V2 again fourth intercostal space left of sternum, in the parasternal area near the sternum, fourth intercostal space. V3 is between V2 and V4. V4 is at fifth intercostal space at mid clavicular line. V5 again in the fifth intercostal space at anterior axillary line. V6 fifth intercostal space at mid axillary line. So these are the leads. Now about leads and surfaces, that is each surface represented by which all leads, that we are going to study now. So the inferior wall of heart is represented by lead 2, 3 and AVF. Lateral wall is represented by V4, V5, 1 AVL. Anteroseptal part of heart is represented by lead V1 to V4. Okay, so this can be actually easily understand by a diagram representing the spatial orientation of the leads. Suppose this is the heart and the arrangement of leads will be like this. This is lead 1. This is lead 2. This is lead 3. Okay, and this is AVF, AVL, AVR. Okay, and the leads in the chest will be like this: V1, V2, V3, V4, V5, V6. So these 3 leads corresponding to inferior wall, and in the lateral part these leads V5, V6, AVL and lead 1. This is lateral wall. Again these leads representing anteroseptal. Okay. So from these changes in the corresponding leads, we can predict which wall, especially in case of MI, which wall is affected. So in case of inferior wall MI, the ST elevation will be on lead 3, lead 2, lead 3 and AVF, and the culprit artery will be RCA. RCA will be the culprit artery. In the case of a lateral wall MI, the leads involved are V5, V6, 1 and AVL. The culprit artery will be lateral left circumflex artery. Okay, left circumflex artery. In case of the anteroseptal MI, V1 to V6 will be affected and the artery will be left anterior descending. Okay, LAD will be the culprit artery. Okay, now a few words about ECG. ECG paper. In ECG paper, there is a big squares and small squares. Actually, it will be like this. Okay, each square, one big square contain one big square contain 25 small squares. Okay, width of one big square is equal to 0.2 second. Okay, this is the x-axis and there is time. This is the y-axis and it is voltage. Okay, so small square is equal to 0.04 seconds. Okay, similarly height of one big square is equal to 0.5 milliwatts and one small square is equal to 0.1 millivolt. Okay, that's about the ECG paper. Now moving on to ECG waves. Okay, so basically an ECG contains a P wave, QRS complex and T wave. Okay, so this is the P wave, this is QRS complex, this is T. Now the P wave corresponding to atrial depolarization. QRS corresponding to ventricular depolarization. T wave corresponds to ventricular repolarization, that is the relaxation of ventricles. Sometimes there may be a U wave, especially in situations like hypokalemia, and it represents late repolarization of Purkinje fibers. Purkinje fibers and papillary muscle. That's about the waves of ECG. Now about segments of ECG. Okay, so segments are nothing but straight lines in the ECG. Straight lines in the ECG is called segment. So there are basically two segments, PR segment and ST segment. PR segment and ST segment. Okay, so during the segment there is no net current flow. No net current flow during the segments, and the PR segment is representing AV nodal delay. Okay, it is a delay caused by the AV node. That's about the segments of ECG. Now moving on to the ECG intervals. Intervals in ECG. Interval means nothing but a segment plus a wave. Interval is formed by segment plus a wave. So there are two intervals. Okay, there are two intervals. Okay, one is this is called PR interval, and the other one is QT interval. These two intervals together form a single ECG wave. So about the PR interval. Okay, so the normal duration of PR interval is 0.12 to 0.2 seconds, and it indicate already discussed the PR segment constitute a P wave and PR segment. PR interval constitute PR segment and P wave. So P wave is atrial depolarization plus the PR segment is AV nodal delay. So the PR interval indicates atrial depolarization plus AV nodal delay. Now about QT segment. QT segment is formed by QRS complex plus EST segment and the T wave. Okay, so from the beginning of QRS complex to termination of T wave, whereas the PR interval from beginning of P wave to beginning of QRS complex. Okay, so it indicates QT segment indicates first one QRS complex. QRS complex is ventricular depolarization and T wave is ventricular repolarization. So QT interval indicates ventricular depolarization and repolarization, and the normal duration is 0.36 to 0.44 seconds. But the problem is QT segment may vary. Sorry, it's not a QT segment. So QT interval may vary with the heart rate. So there is a formula called Besset's formula. should be used to get a corrected QT interval. So the corrected QT interval is equal to QT interval divided by root of RR interval. This is used because the QT interval may vary with the changing heart rate. So this formula should be used and it is called Besset's formula. Okay, so that's for the day. Let's wind up the session for now and we will continue with the steps of ECG reading in the next session.